height, so kind of go in between the two. But we don't want to be bending too low. That's more back strain. So we try to get things up at waist level. And in the protocol I wrote, typically we put the pillow up there, so the nurse would probably do that. And I'm envisioning the nurse would probably cue the person, that we're here today. And then I have an assistant. Rona is my assistant's going to help us with this little boost. So this is a simple boost. Somebody's an alert. So people that are alert, we often use these devices, and we call them trapeze. And so this time we can instruct somebody, would you, put your hands up there. Now bend both knees and put your heels into the foot of the bed. Bend them a little more. Okay, and when I count 3, we're going to have you push with your legs down on the bed, lift with your hands, and we're going to guide you up a little bit in the bed. Okay, your part.
Right.
So I'm telling the patient, now I guess I have to envision the same thing I think to Rona. So Rona, would you get in position if you look towards the, and again, I'm just making this up, but tell me if this makes sense.
Sure.
Rona, come towards the bed. Now stance that you're looking towards the head of the bed, and you're going to put your arm closest to the bed underneath the person's waist, or I'm just saying this. Okay, and your other, we don't know if it's a hand or whatever it is. Okay, so I'll say hand, and put your other hand underneath the upper shoulder. Okay, and this one, because he's alert.
Like we said yesterday, if you put hand here,
Yeah.
you can't accept.
Put it down, right down
But if
the
you
lower.
put it here, it's going to slide off.
Slide. So we're thinking maybe, Rona does it here then?
Just like that book we saw, it was like here.
Yeah.
Put it here.
It might slide.
Can't,
So,
no traction.
so Rona can put it underneath the trunk. So this one being alert, the nurse isn't going to do this. This is kind of, Okay, and then on the count of 3, again, you're going to push your knees down.
It'll guide your head.
And Rona's going to help lift and boost you up in the bed. Okay, ready? So again, we can cue Rona to be ready too, and I don't know if I need to get something back from Rona that Rona lets me know that Rona knows is ready and all of this. But say something happens, on the count of 3, you say ready. Okay, 1, 2, 3,
Ready.
push, and up he goes. So I'm not doing anything for that. So Rona did it essentially. So that's the independent thing.
Somebody who can assist.
And somebody that can assist.
But you both could have,
I could have.
Could have done it in parallel together. Right?
Normally, right, once you scoot down.
So you're dealing with someone who has head control,
gotta
who
get
can
this
lift,
under-
you're not jamming his head into the
Yeah.
pillow, he's
Just, no,
pretty
just
tall.
down.
Yeah, that's, you don't have to hold that.
Okay.
So that pad underneath makes it easier to slide?
Well, in that case, it made no difference, but I will show you what okay, now we don't have Rona. This is 2 nurses doing it themselves, okay, and same thing, bend your knees, put your feet in the ground, we're gonna roll this in, okay, and then, on the count of 3, if you would lift your head and push again with your knees, and push your feet into the mattress, okay? We kind of bend our knees, get our stance ready, we're gonna look to the direction we're going in, 1, 2, 3. So we just do it like that.
And this is, you just, what do you call this maneuver exactly? You call this just?
These are patient lifts. We just did a 2-nurse lift. The one I showed you with Rona then is really, it's the 2 nurse, it's really 1 nurse with Rona.
Right.
Which is saving a nurse manpower.
Right.
This one required 2 nurses.
And it's just to
This is
lift
just
the
move
person,
somebody
to
up in
move
bed.
someone back to the top of the bed.
Typically, people fall, when you see people when the head of the bed goes up, after an hour, people start slipping down in bed. And we don't want them constantly pushing themselves up because they'll get sores on the bottom of their feet. So that's why,
Gotcha.
occasionally we'll just come in and do this, or we'll help them do that.
Okay.
Okay, so then when you're done, we just lift your head up, refix the pillow,
Okay.
put the side wheels back up, and, and then, I guess, I got the up and down one.
Oh, what do you want to do?
I want head of bed up.
Oh, okay.
You get the head of bed on your side?
I have a across, I don't know, Diane, if you've come across this, I was just looking for, on the